but you got stuck taking it after April 1st.
Yes, I did.
So what of NCLEX High Yield did you use? Because you actually passed with the next gen.
Yes. So I did the January, February course, and I used all the other materials like the podcast, the YouTube, and I passed this past Saturday, April 22nd.
Nice. 22nd, what a day. So we are officially PN or RN?
RN.
RN. And so share with people, if you don't mind, first, okay, I have a couple of questions for you because you're next gen. Okay, first question is, what attempt was this for you?
My 5th attempt.
5th attempt, and you passed with the next gen. So now that's words of encouragement right there.
Yes.
And then how many questions were you?
I was 85 and out.
You know, okay, so I see all of these like on our Instagram, people that post all these different you know, like amazing heartfelt warm messages thanking us, whether they use the free resources or they paid. But a lot of them are passing an 85. A lot of people are passing an 85. So what was your experience like with the next gen? Like how did you feel when you saw it for the first time? Because like it's like one of those, whoa, okay, here's my first one.
Yeah, it was pretty intimidating. I did plan on taking it before April 1st, but it didn't happen that way. And so when I took my first like practice test on New World, I scored a 71 on the new gen. And I'm like, okay, well, maybe I'm understanding these questions better than before. I'm not sure. Or maybe I understand the content better. I wasn't sure. But I was like, okay, then I'll just take it after April. What really helped me in my nursing school, we did a lot of concept maps. So I was used to reading charts and like identifying nursing diagnosis. So that came easy, not easy, but it was better for me than the regular questions.
In my opinion, okay, and then obviously I've been teaching this for a while now. I feel that they give you more information in the chart to answer the question than just a simple sentence and then say select all that apply. So you're getting a lot more information and it's more real life, and it makes you feel like, all right, well, I'm a nurse. This is what I'm going to see moving forward. So I think you know, for those of you that are getting close or scoring, you know, well on your exams or your practice exams and on your QBank, I say push hard, because the thing is you got to think like I always say, think like a test maker, right? That's what I always say to my students, think like a test maker. I'm not going to start you off with really, really, really hard questions when nobody's ever seen them before. So you try to take that into consideration. You're just like, all right, cool. So maybe the next gen right now is a little bit easier, then they'll get harder and harder and harder as time progresses. So, but yeah, those concept maps and all that good stuff from school, I mean, they're all helpful. So what is your advice for people on the other side?
Number one is don't give up. Like I graduated 2 years ago, and you know, the thought of giving up was there, but I had a glimpse of hope through your stories, your posts. And so just don't give up, keep going. You're going to be an RN. Number two is really focus on the content. Like Dr. Z always says it, content. Like I realized that when I was scoring low on my practice questions, it was because I didn't know the content. So if that's you, go back and study the content. So those are my main two advices for those who are studying for the NCLEX.
Absolutely. Well, Nurse Jackie, congrats.
Thank you.
And 85 and out, and we are officially in RN. So
yes.
Congrats.
And thank you to you guys. Thank you so much. I wouldn't have done it without you guys. You guys really, Dr. Z, you broke it down to the T. Like, I mean, it was amazing. It was incredible. I now know content that I didn't know before, and I finished nursing school. So I thank you guys and your whole team. So
absolutely. Well, thank you for sharing your story with us, and we wish you the best.